we are so used to be hearing every year the same stuff, and this is not the same stuff, and to hear things that they don't work, well, this new product has two characteristics. One is that it's completely different to what you know, and the other one is that it really works. So I'm really excited to be able to talk to you about this and to be co-presenting with my friend Dr. Padey. So I think you will all be gratified when we end the presentation, because you will be amazed with these results. So today I'm going to present you the CHAC technology, which is a unique way of stabilizing the molecule of hyaluronic acid that has no chemical binding agents like the DDE that we are using in all fillers and all hyaluronic acid that are present in the market. And the range of techniques that we are using for rejuvenating, lifting, and skin tightening on the face mainly, but not only. Okay? I'm Dr. Torres, and I hope you will enjoy our presentation. So whenever we have a rock and we want to give some form to the rock, we know that we have to put some action to be sculpting that rock. Okay? So we need some chisel, we need a hammer, and we are going to be putting some extra force in the rock to be able to produce something different like a sculpture, okay? And when we want a bucket that is, for example, full of water to be lifted, because we want to, let's say, use that water, drink it, or wash something, it's obvious that we need some action, some force to be able to pull this bucket away from the water well, for example, and we need a pulley to lift this bucket, okay? But both of them, the rock and the bucket, are solid, inert substances. So they don't have any living inside, okay? They don't move if you don't move them, okay? But when we are talking about fat and we are talking about the extracellular matrix, we are talking about a soft living tissue. So if something is living, then we have several options, several opportunities of some sort of altering, enhancing, or inhibiting some processes within the cells, within the extracellular matrix. So that is our target. That is where we point our treatments, and that's why we may think differently to obtain different results than we were used to. So the next question would be, is there any room for non-invasive corrections if we are talking about things that work? Because all of us know that if we cut skin and we remove skin because we're doing surgery, there's something that is more tangible. But when you're not doing surgery, can you get some really exciting results? Is that the question? So the answer depends on the patient expectations, the anesthetism severity, the technology that you have available, and of course the patient wishes. So generally speaking, the less invasivity we have, the less severity of the anesthetism, you can be less invasive to get the result. Okay, so the intervention in general should be proportional to the expected outcome and to the anesthetism severity. So generally, when we were trained in the residency, we were expecting to have results around 30% for non-invasive corrections, and to obtain only more than 70% overcome or improvement with only surgical corrections. That is the past. It's not what we have nowadays, because new technologies allows us to get better results with less invasivity, okay? And that I would name base surgery, plasma body type, and in the injectables we have mainly cell booster, but we also have other technologies like peptides or enzymes that weren't able before, but we can use them there right now. So we can redefine the facial contour with cell boosters. That is something that you will see, and you can experiment in your own practice. That is completely possible, and it's absolutely rewarding for the physician and the patient. So what is this different technology? What is this cell booster? So it's a different technology. It's a new article, and it's a new concept. That's why we call them CHAC Technology, okay? So what are the competitive advantages of this new CHAC technology? It's a different way of combining hyaluronic acid with active principles. And it's made in Switzerland by Suisselle. But the most important thing is that it gives us long-lasting results. We are used to many products of methotherapy that you have to do millions of treatments to see nothing. Okay, we are just selling water because everything that you inject lasts only 24 hours. Maybe in the best case scenario, 72 hours. Where this product, it will act for 21 days in a row. Every day your skin will be improving and improving. So how is that possible? Because this technology is capable of stretching the hyaluronic acid molecule just with physical action. And once you stretch this molecule, you get different slots within the hyaluronic acid. So these slots were capable of placing active ingredients, and then you remove the tension, the molecule gets close again, and you get some sort of packing of the active principles and the hyaluronic acid that are protected from the environment. So they are more resistant and they have no chemical agents within the molecule. Okay? You get a slow release of the active ingredients, and you have this unique complex ingredient combination that 1 + 1 that not makes 2, it makes 4, it makes 5, because the results are so much better than anything else I have experienced in the past, and I'm sure you will agree with me on that. So first thing, you have to stretch the hyaluronic acid molecule, and then you get some unfolding capacities and slots are that you can link this active principles, vitamins, amino acids, and so forth. And then you get the 3D CHAC complex formation, stabilization, and it makes a different sort of product because it's more intelligent. It's just like being able to use hyaluronic acid as a carrier and to release the active principles in a continuous manner so you can affect the skin every day and improve the skin every day for at least 21 days, at least, okay? So we have, our range is 4 products: lift, glow, hair, and shape. We're going to assess them mostly all, but we will focus on shift and shape mainly, lift and shape. So the key ingredient in formulation is hyaluronic acid. We have been using it for ages. We know it's the main constituent of the dermis and the extracellular matrix, and that we lose this capacity of forming hyaluronic acid with aging. We know that aging reduces the production of hyaluronic acid, so the moisturing of the skin gets a little bit compromised by that. And we also know that hyaluronic acid has a extreme short life. That's why whenever we inject any mesotherapy formulation, we know that in between, like applying a good cream or injecting something like mesotherapy, there's not much difference, right? So because hyaluronic acid is very sensitive to free radicals and it's very easily degraded. So there are many external factors like hyaluronidase, UV exposure, pollutants, and chemical stress would attempt against our living or against the longevity of hyaluronic acid. That's why the complex stabilization is so important, okay? It's just a geniality that they came out with this idea about putting the active principles in pressure to affect the hyaluronic acid and to affect the active principles. So you get the most of both worlds. You get hyaluronic acid that because of this reaction is stabilized and actually continually like in a more stabilized manner, and the active principles are released in a very daily basis way. Okay, so you have enhanced and long-lasting results, which is the main difference between this product and any other mesotherapy you may be using. Okay, so we have 4 things. One thing is that CHAC technology protects the ingredient from the hyaluronidase. The other thing is that it will increase the bioavailability of the ingredient, and it's a unique stabilization of the hyaluronic acid because it has no BDDE, has no chemicals. We know that BDDE is a plastic, and we know that injecting a lot of plastic is not good for anyone. So this is like escaping about this common stabilization process that we use. So we have optimal ingredient distribution, which makes the compound a lot more efficacious. So we will start with Cellbooster Shake. It is a product that is intended for local fat reduction, water retention, and it will improve microcirculation. So it's intended, for example, for local fat, double chin, liquid retention, and lymphatic drainage. So indications are pretty much there. Fat cheeks, we will show something that we have been doing in the past months, that is applying over the buccal fat pad. We have had great results with that. So as a surgeon, I am doubting myself as how far we will get with these products and how some surgeries may stop to be necessary in the future, okay? So Cellbooster Shake is a complex of hyaluronic acid, which is the main component, but it also has L-carnitine and vitamin C. Vitamin C, it's a fat-burning agent. Whenever you are rich in tissues in vitamin C, you can actually melt fat 30% more than when you are lacking that vitamin. So that will act enhancing your sport effect on the fat cells. And the other thing is that high concentrations of vitamin C, they induce apoptotic death in the adipocytes. So you have two mechanisms by which vitamin C can make you melt the fat, okay? And the other component is L-carnitine, which it is known to be favoring the melting of the fat even when you have sugars that you can extract energy. So you will shift towards extracting the energy from the fat and not from sugars. And the other thing is that the L-carnitine favors the inset or the entering of the long fatty acid chain into the mitochondria, okay, with acetyl coenzyme A release. Okay, so you have some power from there, energy, and you will be melting more fat because of this compound as well. So the program promotes one application every 2 to 3 weeks interval, and then one other application at time 1 month after the first 3 treatments, okay? It should be intended for face, neck, décolleté, back of the hands, but mostly I use it in the chin area and the buccal fat pad, and I really like it. I know that some colleagues are injecting as well in the lower eyelid with very good results. So Cellbooster Lift, it's another composition, and it's intended for reverse of the aging effects in the skin. So we will be feeling soft tissues, preventing the oxidative stress, and favoring deep hydration, okay? It will stimulate collagen production and improve microcirculation and cell nutrition. So what it makes is it will redensify the skin, it will lift and smooth the wrinkles, and it's improve the skin tone in general, okay? So the main indications would be loss of firmness, loss on facial tissue, dehydration of the skin, wrinkles, skin laxity. This is an excellent product for example, when you have done feeders on patients, when you have done other treatments like botulinum toxin, and the patient calls after and said, what do we do now? This is an excellent product for that, because it's something that is a little bit less expensive than a feeder, and it will give amazing results that are very tangible. So the composition of Cellbooster Lift is same, hyaluronic acid, 18 milligrams, and then you have a pool of vitamins and a pool of amino acids, in which we can name arginine, glycine, lysine, proline, and valine. And it really works. It really makes a change in the tissues because it auments the densification and microcirculation of the skin. Okay, so you will be able to see a photographic difference between before and after treatments. It's very tangible. It's something that really works because it will improve the skin tone, and it would place the results, or you will be able to see the results after 2-3 weeks. You can tell the difference. So vitamin B2, C, E, and biotin, they will enhance skin protection because it will augment the skin defense, and it will protect the cells from oxidative stress, and we will prevent the action from free radicals, and for that reason, it will improve the wrinkles as well. Same program, so it would be one application every 2 to 3 weeks, and then another support course after 1 month, okay? So there's a friend of mine which is present here, and he asked me, how would you inject, would you deliver Cellbooster? So if I had to say one word for each type, shape, I would inject it with a bolus. The hair, I would do papules. Lift, I would do fanning with curved cannulas. And the glow, I would inject it in cluster because I would have to go after the pigmentation of dark spots. So that's why I prepare a small video showing the techniques for you. And this is, for example, in the chin area, we want to melt that fat. We inject it very deeply. We aspirate before injecting, and then we inject in a bolus. And we are sure that we are going to get the most of the fat compartment there. This is an application. The other one was Cellbooster shape. This is lift. We want to inject it with a curved cannula that is like spooning the skin, okay? It's very easy to stay very safely here, very superficial, and you can be very effective with this technique and explore or expand the vectors of skin retraction with the product. And the glow, you will inject it with papules or cluster because you want to be like favoring the concentration of the product in the exact area where you have the hyperpigmentation. So this is the result that you can expect with one session, 2 vials applied in the chin area, okay? And this is very similar to a neck liposuction. So my question is, how long are we still going to be making neck liposuctions, okay? Because it's not that all the patients respond like this. That's a very tangible result, and it's very good result. It's 1 session and 2 vials, okay? We inject a lot of material. This is true, but believe me that injecting this material is so much easier than doing a neck liposuction, okay? There's so many vascular structures that you can be damaging when you're injecting or when you're like performing neck liposuction. This is something so much safer and so effective as surgery. So the patients are very happy with this. This is like 21 days down the road, so it's very fast. You have almost no downtime, okay? You have a complete change in the, what we call, cervical mental angle, okay? Which should be around 90 when you're speaking about the muscle, and when you're speaking about the skin, it could be 100, more or less. It should be around 100, okay? So we had a better definition of the mandible. We have a better definition of the cervical mental angle. So a little bit of anatomy, I would talk about the vicious fat pad or the book of fat pad. We have been treating this with Cellbooster shape as well, and it is a tissue that is between the buccinator and the masseter muscle. So they sort of soften the mastication movement, okay? You have some structures that are important to consider, like the facial artery, the facial vein, and in the internal part, next to the second molar, you have the sternum duct or the parotic duct that comes out with saliva, okay? When you are performing surgical removal of this gland, of this fat, you have to be very careful where to place the incision, not to damage the sternum duct. But we have been applying as well some boosters over the vicious fat pad with very good results. So let's just check that one. You have to cleanse the area. You are working inside the mouth, which is always like not clean, okay? Then you can apply a little bit of local anesthesia, and then you apply some Cellbooster shape in bolus. You have to aspirate to be able to be sure that you're not inside a vessel, and we are like 3 millimeters below the sternum duct or the exit of the glandula, okay? So that's application. We are applying with needles, okay? And I'm going to show you some results about this sort of treatment. First, we're going to show you a little bit of Cellbooster lift, okay? We applied this with curved cannulas that I have patented myself because it makes a lot more easy to be injecting your like a spoon, spooning the skin, staying very superficial, and be releasing the product in a very comfortable manner, very intuitive, okay? We inject in 2 areas, mainly in the mandibular angle and in the mandibular angle and the preauricular area. So we have 2 entry points, and then we place the vectors, and we try to favor as much as we can the retraction of the skin. So this is just one session, always 2 vials, and we have a lot of improvements. The face looks completely different, the oval looks different, and the patient looks happier. Yes, of course, it's smiling, but before it's also, she looks happier, okay? So it's a lot of benefits just from one session. You'll be able to tell between 15 and 21 days you get your results. And if we are applying for Cellbooster Glow, okay, it was in South America, it's summertime, it's the worst time of the year for pigmentation, and nevertheless, she looks better, okay? And she has done only 2 sessions. So this Glow product, it works a little bit slower than the other ones, but it still works a lot. It has a lot of benefits over the pigmentation because it will stop the production of melanin. So this is one patient I want to show that we did all the treatments in her, all in one, 4 vials, 2 shave, 1 lift, and 1 glow. So you can see that we have the application in the buccal fat pad. In her, we are going to see the results. And you see, the cheek, the mid portion of the cheek gets sunken because of the effect in the bishop fat pad. You see that the definition of the mandible is much better. And you see that the pigmentation of dark spot got better as well. So everything just with one treatment, 4 vials, and we're going to see the results. So you get a lot difference. The face looks completely different with just one treatment. Okay, you get effects in the definition of the mandible. You get effects in the mid portion of the cheek because of the atrophy of the bishop fat pad. And it's something that is non-surgical, has no downtime, and the patients, they don't feel not pain like injecting phosphatidylcholine or ursodeoxycholic acid. There's nothing like toxicity here, okay? There are ingredients that we have presented to you, so be very safe, feel very safe when you're injecting them, okay? So this is to stimulate you to think different, okay? To give a chance to this non-invasive product, okay? Your patients will be very happy with this. I have tell you this in the past that I'm a surgeon. I like doing a lot of surgery. I start using this product as a bonus for my patients that gave me a positive comment in the social media. Okay, I gave it like a gift. And sometimes they were more happy with this product than with my surgeries. Okay, and that is just to explain to you that these products really work. Okay, these products are really different. So give it a try, and you won't be disappointed at all. I'm hoping that you will give a try to this product, but start thinking differently, okay? Don't think like a rock in a bucket. Think like soft living tissues that you can stimulate and interact with them. You can interact with the cells. So start thinking a little bit different and start thinking Cellbooster. Thank you very much for your time, and I hope you like the speech.
So good afternoon. Sebastian already told you the most important about this project, and I can add that it changed totally my practice. When the laboratory came to me the first time, he said, "Oh, we have a new product." I said, "One more." And finally, I said, "I try." And at once, I saw an evident result. So I continue to work, and now I have a 1-year experience with this project. And I choose a few protocols, and I can tell you that it's a revolution in the practice. We are both surgeons, but finally we inject more and more, and we use this product as a very good device. And it's why I wanted to show it today. Okay, so you have the 4. First, we have to remember that this CHAC technique is absolutely patented for this laboratory, and it changes, the result and the efficacy of all our injection. So I pass very quickly for that because Sebastian told you already. It's very important, to remember that we have to find all the time a good innovation for product and treatment, and this way is very satisfying. Why? Because we are protected, all of the aggression of hyaluronic and so on, and we have to get, very good result. So what I want to do today is to show you more techniques with these files, how we can use them, because like that you can apply and you can see, you can choose a treatment. You can choose one return, make a session, for example, with shape, another session with lift, or session for glow, or hair at some way. But sometimes you can also combine the technique. It's what I like to do. So the protocol for that, you have the glow, will be more interesting for the skin preparation, the good quality and good hydration of the skin. So you clean your skin, of course, as all our topics, and you can use topical anesthesia. We are surgeons, so we are a little more rude, but it's not painful at all, and it's very well supported to treat as well. For the glow, you can use papilla or bolus as well. Injection angle about 30 degrees, and you can use the best is needle. For I guess for a glow by itself, volume injected you can use in one session 1 or 2 vials. If you combine with the other product, it's better to use only one. It's enough, but you can use 1 or 2 vials of 3 cc each for each session. Deep papilla for this glow, and you can be located on all the full face, neck, cleavage as well, back hands. You can use it everywhere with no risk, and you have at once, a very glowing effect, a good hydration, and you also have a good reflex and a good answer on all the problem of pigmentations. Micropapilla as well, you can choose a localization, especially, all around, the perioral area. And you can finish, when you combine with the other technique, I like to make a small nappage to finalize, my result of my session. Okay? For the lift, injections, the protocol, it's the same way you prepare the skin as well, topical anesthesia. And in such case, you make also papilla. You can also use with the fanning technique. But injection 30 degrees as well. Injection deep interval, that is every 2 millimeters, and it's very good enough. And you can use a 30 or 32 gauges needle, and it works very well. Sometimes when I use fanning, I take also cannula, 25 gauges and 50 millimeters. For the fanning, this was a little in advance. So you can make, especially fanning technique, I will show you on the next patient, all the full face. Neck, you can make it all with a cannula or needle. For the neck and cleavage, I prefer needle. For the micropapilla as well, I will show you with the patient. It will be much easier for you to see. Okay, for the shape. As we told, we are maxillofacial, and we were making a lot of surgery of Bichat fat. Now we inject almost 90% of our sessions. And it changed quite a lot. It's more comfortable for the patient, less traumatic, very good result, very quick result, no downtime, problems after surgery we can have, especially infection in the mouth. So it's interesting. Sometimes I make just a local anesthesia, same way than you, and we inject 1 or 2 vials, same way. And it's funny because also when we did not know each other, in fact, we realized that we use the product in the same way, and we were surprised in the same way. And when I say it's an evolution, it's because it totally changed our way and our approach with the patient, because we make them more confident, we make them more comfortable, and it doesn't take any problems. Fanning technique also can be done, but I prefer with needle, perpendicular, and a little deep. Papilla is the best way. For hair, you can inject every 2 millimeter deep, every 2 centimeters. I'm talking about the rule of 2 centimeters, because it's very easy, 2 millimeter distance, 2 millimeter deep, 2 centimeters interval. My protocol, it's my favorite, in fact. I use first shape with a local fat deposit in a different place as well. And after that, I work with lift and then with glow. The first time I said maybe I'm too much invasive and why not, and finally I tried and I was quite happy. And the most surprising also, there's 30 years I'm injecting on this market, and it's the first time that my patients called me after. Usually they said, okay, we are happy, it's good, and so on. But here they said, we feel different, we feel comfortable, we feel very satisfied. And that for us, it opened our mind, because we said, if people realize we are doctors, so we understand what we're talking about. But this patient feel a sensation they never had whenever they had other treatment. And that is very interesting. This case of one of our colleagues, she's 52 years old. So you can see before the aspect of her skin, as she was quite dry and so on. I made one first session, and with 1 vial of shape, 2 vials of lift, and 1 vial of glow. And it was already good. She was quite satisfied. As we had normally, I should have waited for a 3 weeks interval, but as we had Monaco, I waited only 2 weeks. But you can see the result. And it's really interesting because right after that, she's a doctor too, and she explained that whenever I made her a lot of injection with fillers, she was not so satisfied than with the cell booster. Which means people now are younger and younger. So as we are young, if you don't overcharge with a lot of fillers, and you can be very successful in a good way, we must do it. And it's a new approach. It's why I like that. You can see on face, you can see on profile, same way. And especially, all the small wrinkles over here disappear very quickly. And that is very interesting. So you can see 1 month interval, both 2 sessions, only 2. I will make a third one very soon. Here she was a little tired, and I can say at the second session it was a little more sensitive. And I remember when I wanted to make a video on a décolleté, it was the end of the session, she was really tired and she said, stop it. Anyway, we could do it. You see in profiles as well. And she was feeling all the time, she was very uncomfortable with the chin. And the double chin, is a very big complex for a lot of ladies, and we are more and more satisfied. It's why I like very much. I use sometime, for this time, she had here, so in each session, 1 vial of shape, only over here. I will show you with the video after that, but I wanted to see, to show you the result, and especially on the CrossFit as well. Double chin over here, and all the cheeks and all the middle level. Okay, I use bolus of injection at 90 degrees, for all the triangular of the fat deposits over here. And I use the injector, it's about 4 to 6 millimeter deep, and it's subcutaneous fat, okay? The volume injecting each point is between 0.05 to 0.1. And it's a little burning at the first session, but after that it was very comfortable. And she said at once, oh, my neck is more comfortable. Okay? When we complete, after that, I choose, the lift fanning technique. And in the same way, it's very interesting because at once, we were completing why we first work on the fat deposit. After that, we work on a stretching effect and lifting effect of all the face. And I made, a fan technique on the cheeks, on the chin, and all along the mandibular as well. I made also, not in the triangular of the shape injection, but all around, all the neck with vertical point. You take some line, you make small bolus of 0.05 each, and all the décolleté in a triangular this way. So for that, you need 2 vials if you want to make a real big treatment. And then you finish with the glow, and in such case, small point everywhere. You inject slowly, small point, very gently, and you can see that it's more comfortable for the patient. It's more comfortable for the patient. You can see in the video. I like very much to use, cannula. Well, so, small points. Don't forget to take as much as you can syringe with a screw, because sometimes you have a small resistance, especially at the first session, when it's the fat, very deep and dense, and sometimes you can lose product. So be careful for that. Okay, few points. I did not put any local anesthesia. That was it's the second session. And sometimes it was a little sensitive for her, but she could support as well. Small point. Normally, it's not bleeding too much. You have no eviction. You can make it, and the patient can work just after that, and it's very comfortable. Sometimes you can put ice just at the end of the session as well. The video takes 6 minutes about that. We can show you as well. But every time, as much as you can, start with shape. Start with a fat deposit, and after you will go forward for the rest of the skin. So you see that you have not too much resistance. Very comfortable for the patient. Sometimes, on her, I did not did it. But sometimes I have few patients, I told also tomorrow for that, I like to make a mesobotox to patients. I see them 10 days after that, and after I treat, with the quality and with the Cellbooster. This Cellbooster, it's new. It's new. It's we realize, especially, how we can be efficient and how we can finish, the comfort of the patient. We change totally this area. And I use less filler. We make less surgery. I have no words, because I'm totally convinced. And the first compliment we can have is the reaction of the patient and the satisfaction that he can have. Okay, I think after it will go a little more to see with cannula as we are injecting, like Sebastian, on the cheeks. See. The second session, I realized at once the feeling of the skin was different. The first time, you think if you touch a egg, it's very dense and so on. And the second time, my needle was entering, much more easier. After the cannula, and I make all the oval, all along the oval. We can go also at the marionette folds over here. Normally, it's not bleeding at all. Here, we have the camera, we have the light, and so on. It's why you can have a small bleeding, but that's it. Okay? You can see that she started to be tired, because it takes time to make the video, to make her comfortable, a lot of product. Sorry? Yeah, it's lift. Shape first, lift after that. And with the lift, especially, is why I wanted to show you this video, because with the cannula, you can go up all the crossfit over here. A couple of times ago, we were using a filler. But using a filler in this area, sometimes you can have a pumping effect. With the Cellbooster, you don't have anything. You can make a small massage over it, and it's really fantastic, the result is instant. Okay. Tac. For that, also, you can go with one hole under the zygomatic over here. You can go through, the philtrum over here to work on all the code bar over on the upper lip, and it's also very efficient. And I used the 2 vials. Okay, and maybe we have some points with the glow after that, I think so. But don't inject on the same area shape and lift. Shape is especially the fat deposit, and lift will be all around the face, but lift and glow, you can mix them without problem. It's why I said needle for shape, cannula in preference with lift, and point by point overheat with glow. It's my favorite technique, but we tried a couple with the time, we wanted to explain how we can be, satisfied with our technique and result. And the first session, it took me about half an hour to 1 hour to make all the procedure. Now it takes me half an hour. Here, of course, we take time and so on to prepare the skin and everything, but it's very quick and very comfortable, and we are very quiet for that. After that, the massage is evident. First, because you relax the patient. She forgot you were a little rude, and you appreciate as well. I have a fantastic result. I can show it. I was surprised by myself because he's smoking, and here he has 3 sessions. On the last picture here, he has COVID because I thought he could be very tired and so on. So, and finally, the result of the picture was quite surprised. And I wanted to show you it because, and I make 1 vial of shape and 2 vials of lift. Nothing else.
No Botox?
No Botox, not at all. And I made 2 on each side, 1 cc of Forte. And the angle, because he wanted to have a Texas face and a square face. But this one, it was quite one of my best results, so it's why I wanted to show you. And you can see that with not a lot, a big amount of product, we are very efficient. It's not too much expensive also for the patient. We have to think and to complete our treatment as well. It's why it's, when I said this product is a revolution, I agree, and I think you think the same. It's a couple years ago, we could have used, threads or something like that. I forgot all these techniques now. I'm very happy, and you have no risk. You can combine fillers, and we are exactly, Cellbooster is between meso, between fillers, and I think it's the future for us. And when you have also a few doctors who are beginners, they are afraid, they cannot rush instantly, with cannula or something else. And I think it can be good to. But I trust this, I'm totally confident with this product. And if we are here, it's a reason. We are very enthusiastic with it. And I think next time we shall show you more and more because we try techniques and everything. And to see, to show you how it can work and how it could be efficient. Whenever I did not use a filler, we could be already very satisfied. Okay, thank you very much.